How do you know you've got a neck problem that actually needs treatment? Hi, everybody. This is Dr. Jeffrey Hanna here at Chiropractic, and this is one of the most common questions that people ask us. I experience different kinds of symptoms in my body, but I don't know. Is there a possible connection with some kind of an injury in the neck that needs treatment? So what I want to cover in this particular video are 4 things that you can be doing. A few of them need no fancy testing whatsoever. A few of them need just a little bit of a look. It doesn't require like deep invasive kinds of tests, but with this kind of information, you can know if there is something that's actually going along with the health, the alignment, the motion, the stability of your spine, particularly your neck, that can be contributing towards so many different kinds of health issues. And this is an important principle I want to hit on first, and that is that when we experience different symptoms, different ailments, odds are that we don't have a dozen different things wrong with us. Instead, what's far more likely is that we have 1 or maybe 2 things that is showing up in a dozen different ways. In other words, if we look at the combination of symptoms that people can experience, if we can find what the root cause is rather than just focusing on the effect, we have a much better opportunity to not just feel better, but really to resolve whatever that underlying condition is. So without further ado, let's jump into these 4 things. Numero uno is posture. Posture has absolutely nothing to do with laziness. It's the outer reflection of what's going on beneath the surface, particularly when we are seeing sideways kinds of tilts or twists and rotations in our body. Now, this is a very simple test that any person can be doing. You just simply stand up in front of a mirror and you have a look. Does it look like your nose turns one way more than the other? So does one of your ears looks like it shows up more to the front than the back? Do one of your shoulders look higher than the other? If you've got a couple of scales, very simple test. Stand with 2 feet, 1 on each scale, and look to see, is your balance level? It should be the same, plus or minus about 5 pounds, 10 pounds if I'm being quite very liberal. My point here, and how does this relate then to something with the neck? Well, we have what's known as the vestibulocervical or the vestibulospinal reflex. In a nutshell, what it is that in order for the brain, the centers of equilibrium and balance, to be functioning properly, it requires that the head actually stays level relative to the horizon. And if a person has issues anywhere in their spine, but particularly their neck, because there's a huge amount of nerve receptors in this area that send the brain information about where the body is in open space, if there's a problem with the spine, what it's going to do is it would cause the head to tip like this. So rather than having that happen, brain is going to balance itself out, and it's going to mean that the rest of the body is going to appear to be somewhat crooked. And over time, this can lead to a lot of different downstream effects. I say this all the time, is that where the pain is not necessarily where the problem is. In other words, we can appreciate, just looking at this little picture, let's say that the issue is actually going on in the neck, but it's causing the body to tilt like that. Well, if you multiply the stress and strain on the muscles, the ligaments, the joints, the nerves in the shoulders, in the low back, depending where your individual Achilles heel is, that's more likely where you're going to be experiencing the pain. But that does not necessarily mean that is where the problem had started from the beginning. Now, how can you actually localize if the problem is coming from your neck? Well, this one you might need a little bit of assistance with. Simply put, you just simply are going to lie face down on your bed with your feet extended over the edge of the bed. And I do recommend, so that you can still breathe, put a pillow under your chest somewhere right about here, so that way your neck is able to tuck down like this. And you can have husband, wife, kids, family member, friend, whoever. You look at the relative balance of the legs here, because we should be the same within about 3 millimeters. Or about 1/8 of an inch. If you start to see imbalances that are going to appear like this, that means that there's some kind of neuromuscular tension in your body. And that shouldn't be there. So the question is, how do you know if that's coming from your neck? Very, very simple test. When you're lying face down like that, turn your head one way and then turn your head the other. And your examiner will have a look to see, does your leg appear to either balance itself out or does it ultimately pull up? Almost all of the rotation that occurs, not just your neck, but your whole spine, happens right here between the C1 and between the C2. So if the only thing that you do is turn your head and you see a change in the muscular tension all the way down at your foot, by default, that means that your spine is going along for a ride and there's something that's most likely going on in your neck. Now, I'm going to do a quick pause here. Why am I going through all of these little discussions here in the first place? If you're the kind of person who believes that prevention is better than cure, then these are some of the things that you can be looking at where you can be more proactive when it comes to staying on top of your health. We know that when it comes to something like cavities, how many times have you gone to the dentist and your dentist says, you've got a cavity, we need to fill that? And you're like, oh, okay, that's not good, but I need to do that. Why? It's because if you don't, it's only going to deteriorate and get much worse. But here's the thing. Your dentist is finding the problem before it's actually causing you pain and symptoms. Your body is absolutely brilliant in its ability to adapt to stress, whether it's from the inside, whether it's coming from the outside. But it can only take so much. Now, here's the kicker, is that our body will oftentimes give us very subtle signs that things are not quite right. But we don't actually experience pain or crisis until we are down about 50% from where we are supposed to be. In other words, just because we don't have pain doesn't mean that there's not a problem at all that requires treatment. And if we can listen to some of those more subtle signs, or be proactive, making sure that we're actually taking care of our spine, taking care of our body, that can go a really long way to help protect or prevent certain kinds of conditions showing up later in life. So I hope that you're taking these tips to heart here so that you might be able to prevent rather than wait for cure and crisis. Right, number 2, this is the loss of what's known as your cervical lordosis. The lordosis refers to the forward curve of the neck like this. Loss of a cervical lordosis, and I'll get rid of that bar in just a sec, is going to look something a little bit more like this, where what you can see is that the neck has quite very straightened up. In fact, it is now curving the exact opposite way that it was in the beginning. And why does this matter? It's because when this happens, this is going to start to stretch the muscles, the joints, and potentially ultimately the nerves in your neck. It doesn't mean that anything is getting compressed or crushed per se, but it does mean that when you have abnormal loading, you've got forces that are going down through your joints, your disc spaces in ways that they were not designed for. And over a period of time, this can lead to some pretty significant kinds of issues. Now, how do you find this out? Well, you can look at a person's posture. That's a pretty good hint. One of the major hints is if you see that a person's head is sticking forward like this. If you're looking at us from the side, the tip of your ear should be over the tip of your shoulder. If it isn't, and if your head has the tendency to stick forward, whether you are sitting, whether you are standing, whether you are sleeping, odds are that you have a reduction of the neck. If you want a little bit more of a deeper investigation on that, a very simple x-ray oftentimes illustrates that. But the question is, why is this so important? Here's just one example. Effective sagittal alignment on spinal cord biomechanics in the stenotic cervical spine during flexion and extension. Let me say first, what is a stenosis? I've done other videos on this one here, but as a brief recap, stenosis refers to a narrowing. It's not a problem per se of the bone, but it's if the bones, the joints, they start to encroach on the spinal canal itself. What that does, that can start to produce a narrowing. When there is a narrowing, then you are more likely to have a stretch or even direct irritation of the spinal cord itself. And your spinal cord actually oscillates like this, about 2 centimeters or so up and down with every beat of your heart and with every breath that you are taking. Now, if you then have a stenosis, it means that the disc, so let's say that this is the disc right here, can be gently abutting against the connective tissue around the cord. So as your cord's going up and down like this, if that happens once or twice, no biggie. But if you consider that your heart beats about 1 million times every month and that you have this little bit of rubbing, that little rubbing over a long period of time can start to make some really nasty kinds of things. Most common are what are known as myelopathies, neuropathies, and depending on what level of the cord, if it's occurring in your neck, this has the potential to produce all kinds of downstream effects. Not just pain and tingling or numbness into the hands and the fingers, but it can also be, and is shown, implicated in low back pain, in sciatica, numbness and tingling down into the feet. In other words, lots and lots of different things. So what do these particular researchers comment about? Cervical kyphosis was associated with greater spinal cord stress and strain during neck flexion and extension. And the magnitude of difference increased with increasing stenosis. Cervical kyphosis increases baseline spinal cord stress and strain. In other words, if your head and your neck are locked into that backward kind of configuration, this is setting you up. It's lowering the threshold where it is far more likely that things can start to go awry and you can start having pain, you can start having muscle tightness, or you can start having some of these different neurological kinds of issues. Now, in the nature of our day-to-day, we are leaning our heads forward all of the time. We can't get away from computers, from mobile devices. I mean, we can't even get away from books if you think about it. But what we need to do then is we're making sure that, like brushing your teeth to prevent and protect against cavities, that we're doing things that actually are going to help support the normal curve of the neck. And there's a few ways that you can actually be doing this on your own. The simplest version, literally, lie flat on your back on the floor. That's it. You're allowed carpet, you're allowed a yoga mat. What that does is that produces a gentle stretch, and you just are using gravity to help bring your head backward like that. There's also all kinds of different devices that are out on the market. This is one. I get no kickbacks or advertisement, anything like that for this. But this is one of them that I like. It's called a neck relief. This is done by a company known as Cervical. Simply put, you can see that when you are lying on your back, this would be supporting that normal lordosis in your neck, but without forcing it. There's a lot of devices that I've seen that are designed to, quote, restore the normal cervical lordosis. And these are useful, but what I find that they do is they produce too much force through the different joints, and it's more likely that it's actually stretching the ligaments out a little bit too much. And I will add this, is that even if you can't completely restore the can't talk. If you can't restore the normal cervical lordosis 100%, that is okay. If you can restore normal motion and normal flexibility, that is what actually matters the most. So something like this, or again, even lying flat on your back, that goes a really, really long way to help protecting your neck. In fact, if I was going to be saying, what's the number one most important thing that a person can do for their spine? Well, number one is going to be exercise. Number two would be this stretch right here. Now, in and of itself, that may not fix all of the underlying issues or all of the problems, but this is one of the easiest things that a person can do first and foremost. And if that solves the issue, wonderful. If it doesn't, you've been doing this kind of stretch, you've been giving it a fair go for at least 2 weeks, but something still feels wrong, this is a sign then that something is locked up on a slightly deeper level, and you're probably going to need a little bit of professional help with this, either upper cervical chiropractor, a specific chiropractor, a specific physical therapist, specific massage therapist, lots of different avenues through here. But try that stretch out first, goes a really, really long way. Number 3, arthritis. If you already know that you've got arthritis, there is a problem in your neck. Simply put, I got into a spat some years ago after a client of mine had gone to her medical doctor, and the medical doctor looked at her x-rays and said, "Oh, you've got arthritis, that's normal. Don't do anything about it." It's like, hello. No, you can't undo degenerative arthritis. Degenerative arthritis, think of it like rust. It's the slow accumulation of abnormal wear and tear through the joints where they remodel themselves over a period of time. And this is a consequence typically of one of two things. Number one is going to be a repetitive stress strain injury. Number 2 is going to be an old physical injury that didn't break, didn't dislocate, and maybe there was no bleeding or broken bones or even bruising, but there was still damage on the inside. And as a consequence, over a period of time, those joints have been moving abnormally to where they start to accumulate rust. When that rust happens, that is going to start to have an impact on the alignment, the motion, and as we see in this case, also the openness in and around that person's spinal cord. And as you can see, here's an example where that curve in the neck is starting to go backward. When a person's got arthritis, this is going to be producing clicking, this is going to be producing grinding kinds of sensations, and it means that it's also lowered the threshold. It's more likely a person's going to experience pain and stiffness. Now, as I had said before, you can't undo degenerative arthritis, but I do repeat what I said previously, is if you can restore as much normal motion, as much normal stability, and as much normal flexibility as you can without overstressing, without overstraining the joints, because they've been damaged. You have to take good care of these. What you can do is you can start to feel better. I see people all the time where they are just shattered with arthritis. And they're like, oh, okay, yeah, I'm a little stiff in the morning, but that's about it. Other people, they've got a sliver of this and they're in agony all of the time. My point here is that arthritis is not a death sentence. It means, yeah, you've got a much smaller margin of error, but that doesn't mean that there's nothing that can be done. If you can give your body even 1 to 2 millimeters worth of additional flex and mobility, oftentimes that's enough where a person says, okay, I'm feeling a lot better here. I can do the things that I want to be doing in my life, and you're pretty much good to go. Now, the way that you find out if you actually have degenerative arthritis, simple x-ray. CBCT is even better because you get to see everything in three-dimensional detail, but you can see just like that if you're dealing with wear and tear in your joints. Now, if you do have wear and tear in your joints, does that mean that you should not see a chiropractor or a physical therapist anymore? Short answer is absolutely not. If anything, it means that you need to work with one of these professionals and keep doing a regular exercise routine so that you can have as much normal stability and function through those joints as you possibly can. But in the same breath, I will exercise specificity, precision, gentleness. When you've got wear and tear through the joints in your neck, it's not a good idea to be excessively stretching. It's not a good idea to be using large amounts of rotation. It's not a good idea to be twisting, popping, cracking the neck every single which way. It requires a focused precision point so that you're able to work through the joints and not to be causing additional strain that can only aggravate things like that. So can you still get treatment? Short answer is absolutely yes, but make sure that you emphasize precision. And the last one, number 4, is balance testing. I've done a lot of videos on this. In brief, you've got nerve receptors in your neck, as we said at the beginning of this video even, and they're going to tie directly into the centers of your brain that are responsible for balance and equilibrium. Balance and equilibrium are controlled by 3 major players: eyes, inner ear, and then the rest of the body, but particularly the joints in the upper part of your neck. And in fact, what these researchers are looking at, they're finding that there's an association. People who experience generalized neck pain are more likely going to be experiencing balance kinds of issues. And the way that they're detecting that is what's known as postural sway. If you were to stand up in front of a mirror, you would probably see that your body actually sways a little bit like this back and forth. But if you have damage through the joints in the neck, what you start to see is you start to see where the body's actually roving and swaying a little bit more side to side, kind of like this. And when a person actually experiences an overt vestibular disorder, you can actually see and measure that sway pretty substantially. So what did these particular researchers find? Again, they're looking at people who experience neck pain. Subjects with neck pain showed a lower static stability index, static sway index, static stability index, forward, backward, and static sway index lateral scores than the normal counterparts. In other words, people, when they've got neck issues, they're more likely that their body is going to be moving subtly side to side like this. And this opens up a huge opportunity here. And what that is, because like we had said in the very beginning of this video, is if you believe that prevention is better than waiting for crisis and cure, then what that means is that one of the other tests that we can be doing to have a look to see if a person may have an issue with their spine is by testing balance. So people who might be experiencing little bits of disequilibrium, people who feel that they're clumsy or that they're always tripping on one side, that could be because there's that posture distortion. The one leg draws like that, and so we're not working symmetrically. We can look at the base of a person's shoe to see if there is even amounts of wear and tear. There's lots of opportunities right here. But if we've got this kind of connection, or at least initial information about this kind of connection, it means that we don't necessarily have to wait for a person to experience pain before we do anything about it. We can do very conservative testing, looking at posture, looking at balance, to determine is there something that's worth investigating more so that we can prevent issues rather than waiting for a crisis. So there we go. 4 simple things that you can tell if you're dealing with some kind of a neck issue. Brief recap is, and in no particular, well, we'll go in the same order. If you have issues with your posture, if you have a lot of forward head like this, which means backward curve in your neck, if you already know that you've got degenerative arthritis or you hear clicking, grinding movements going on in your neck, or number 4, if you experience some kind of balance kind of issue, or you notice that in terms of just the way that you move, that things are not exactly the same either side. So all of these very, very simple conservative ways that you can assess, is your neck functioning the way that it should be? Now, if the answer is yes, kind of like going to the dentist where you got no cavities, that's what you want. Wonderful. But in huge amount of people, they actually experience these different kinds of issues because we're in front of, again, computers. We use our phones wrong. We use pillows wrong. We sit wrong. All of it's designed where it's basically causing the head to slump forward like this. That is setting us up for problems later in life. So if you are the kind of person who wants to prevent, then what that means is you can go to see a specialist who does these very basic non-invasive tests to find out, is there something amiss with your neck? If so, what's the most appropriate treatment? Now, usually what that involves then are a few additional diagnostic tests so that you can see exactly what's going on the inside. And then, as we had mentioned, especially in the arthritis section, you want to make sure that you're getting precise corrections. Not just a matter of gross mobilization or stretching or twisting the neck, but we're all different on the inside and the outside. So we need to make sure that any approach that we're receiving is going to be tailored and suited for our individual needs. And if you want more information about what this procedure is, what we can do to help out, you can go to my clinic website, which is clearchirospokane.com, or you can also check out a directory if you're not in the inland Northwest US and Canada. It's called UCC Near Me, where you can find a specialist in what's known as cranial cervical care. This is a different form of healthcare. It does not involve drugs, doesn't involve surgery, and there is no stretching, rotation, or twisting of the neck either. So thank you guys always for watching the video. If you liked it, please do click the like and subscribe button and share this with friends, family, member, clients, colleagues you think would benefit from watching this one here. Thanks again. You guys all have a great day. This is Dr. Jeffrey Hanna at Clear Chiropractic Spokane. Get well, live well, stay well.